The Centers for Disease Control and Prevention announced a new program to monitor anyone returning to the USA from Ebola-affected countries in West Africa. The program will begin Monday, said Thomas Frieden, director of the CDC. Passengers will be monitored for 21 days, the incubation period for Ebola. The program will focus on the 6 states where 70% of travelers from Ebola-affected countries arrive: New York, Pennsylvania, Georgia, Maryland, Virginia and New Jersey, Frieden said. Countries in West Africa are screening passengers before they leave their country. And airport staff in the USA are screening passengers as they arrive at any of the 5 airports that now allow travel from Ebola-affected countries: Guinea, Sierra Leone and Liberia. We're checking at exit. We're checking at entry. We're checking each of the 21 days, Frieden said. We will continue to do whatever we can to protect Americans. But not all people with Ebola will have a fever when they are at an airport, Frieden said. It's possible for a person with Ebola to develop symptoms any time within 21 days of infection. Public health staff will stay in touch with the travelers every day. States in the program will set up toll-free numbers for people to call if they are concerned about their own symptoms. Passengers arriving in the USA will also get a kit that includes a thermometer and information about Ebola, Frieden said. Travelers will be asked to take their temperatures twice a day and report the results once a day, Frieden said. If passengers don't report, public health staff will track them down to check in. If someone is ill, they will be isolated, Frieden said. If someone is at high risk for Ebola, because they were exposed to someone with Ebola, they will be quarantined, Frieden said. Nigeria used these measures to limit the spread of Ebola with great success. That country's outbreak is now over, with 20 cases and 8 deaths. These measures would likely have detected the symptoms in Thomas Eric Duncan, a Liberian national who became the first person diagnosed with Ebola in the USA. Duncan was sent home from a Dallas emergency room when he first developed a fever, only to return days later with vomiting. He died October 8. All of his contacts have completed their 21-day observation periods. 2 nurses who treated him developed Ebola. Other health workers who cared for Duncan are now past the highest risk period of their observation period, although workers will be monitored until October 29, 3 weeks after he died. Health workers caring for the 2 nurses from Dallas will extend for some time, because the nurses are still hospitalized. About 150 people a day arrive in the USA from the 3 Ebola-affected countries. According to the World Health Organization, more than 9,200 people have been infected with Ebola and more than 4,500 have died. Until we can stop the outbreak at the source, we can do lots of things to reduce the risk, Frieden said. But until the outbreak in Africa is over, we can't get the risk to zero.